Hello, everyone, and welcome to the June PQA Quality Forum Webinar. My name is Amanda Ryan, and I am PQA's Director of Education. Today's topic is the voice of the patient in medication therapy management. As usual, I would like to call your attention to 3 housekeeping items. First, all attendees are encouraged to ask questions during the presentation using the questions panel that's on the right side of your screen. At the conclusion of the presentation, I will read the questions aloud for our speakers to answer. Second, the webinar recording and slide deck will be available to PQA members within the week following the presentation in the Member Resources section of the PQA website. And then finally, I would like to encourage all attendees to complete the quick 1-minute survey that will appear at the conclusion of the webinar. It is now my pleasure to introduce our speakers for today. Danny Marcus is Vice President of Product and Quality at Outcomes MTM, where she leads quality and product development strategy programs to optimize medication use and improve patient outcomes. She guides continuous quality improvement efforts to advance program efficiency and enhance value of MTM programs. She is also a staunch advocate for high-quality patient experiences and advancing pharmacy. Stacy Emmons is the Director of Outcomes Performance and Adherence at Walgreens. She has worked in the community pharmacy setting for over 15 years, and through her career continues to be an advocate for patient health care and health outcomes provided through the profession of pharmacy. Stacy leads a team of pharmacy professionals dedicated to the improvement of health outcomes through a differentiated omni-channel experience. She is a member of the PQA Education Advisory Council and the National Medication Therapy Management Advisory Board. We are also pleased to welcome Richard Erickson, who has been a PQA patient representative since 2017. A retired Marine Corps veteran, Richard was stationed in Vietnam, where he came in contact with the herbicidal chemical known as Agent Orange, the precursor to his type 2 diabetes diagnosis in 2006. In 2010, he started a diabetes support group at his local clinic, and he currently serves on a Health Partners work group to bring the patient's voice for the treatment and communication approaches for people with depression. Mr. Erickson has served as a panelist on several presentations regarding quality metrics, performance measurement, medication management, and other topics, and he is pleased to share his medication therapy management experience with us in today's forum. Thank you to all of you for being here today. And with that, I will turn the floor over to Danny.
All right, thank you. And hello, everyone. I'm excited to be here today to give you a little bit of a glimpse into what the patient experience looks like from our perspective in managing MTM programs across a nationwide network. I'm going to start by laying the landscape that's happening in the industry. As many of you probably know, member experience continues to be more and more of a focus by CMS. And that is being reflected with what's happening and changes they're making to the star ratings. So I'm just going to cover some of those changes that we've been seeing to illustrate that increased focus. So there are 6 separate domains that include a total of 16 measures that relate to member experience in one way or another. So this is obviously across the entire plan and all the areas that they cover. So that's pretty broad. Really, that means 36% of the measures in the full set of star ratings is related to member experience, but then when you look at the weight of those measures, that actually impacts 57% of a plan's overall star rating. So when you put things into that perspective, you can see the significant focus, and that obviously will reflect in the activities and program design and interactions that the health plans are going to be and PDPs are going to be focused on when it comes to providing services to these members. The weight is an area where they're also placing increased focus. So we've seen some of those increase from 1.5 weight to 2, and now we're seeing that even more of a higher weight from 2 to 4 for these member experience measures, and that will take effect in the 2023 star ratings. So you might be asking, what exactly does this mean? So on the next slide, we can look at what the specific measures are that are getting categorized as member experience. So you see the domains on the left. So again, many of you might be familiar if you're working in this world day in and day out, but for those of you who aren't, I think it's helpful just to get a refresher on what types of things are being measured. So if I go down the domains, member experience with the health plan, and then the specific measures are on the right-hand side here. So measuring whether the member feels as though they're getting needed care, can they get appointments and care quickly? What is their customer experience or customer service experience? How would they rate their healthcare quality? Rating of the health plan and care coordination are some of those specifics. And then you'll see the next domain, member complaints and changes in the drug plan's performance. You'll see those in red because they're that is measured for in Part D star ratings, and it's also listed on Part C. So when you're looking at a Medicare Advantage plan or across the overall stars, those wouldn't be duplicated, but that's why you see those duplicated here. So that's going to be specific to the drug plan. So complaints about those and members choosing to leave. And then we have health plan customer service, drug plan customer service. So this is going to be around appeals and decisions, call center focus and what languages and TTY availability is there. And then lastly, the member experience with the drug plan is the rating of the drug plan and getting their needed prescription drugs. And I think something to keep in mind is I feel like it's sort of human nature that if you have, I don't have statistics to back this up, but you know, it takes many good experiences to outweigh a bad one. So even if someone has a bad experience, whether it's with their health plan or in another area working with another company or trying to get a service from an organization outside of healthcare, if you have one bad experience, that might reflect how you feel in other areas. So I think that's why you're going to see an increased focus in this across the board, because a lot of this is survey based, and if they had one bad experience in a certain area, that might actually reflect in a person's head in other areas. So it could have even broader impact than maybe what the actual instance was. So this just kind of illustrates the impact of that weight change from 2 to 4. So if we just kind of try to implement that weight change on the 2021 star ratings, we see that 78 of the 400 contracts, or around 20%, would have seen their overall star rating increase. So that hopefully is giving plans confidence. But of course, we know this is the methodology for calculating star ratings is kind of on a curve, so you probably can't assume that this is going to play out exactly in this way in future years when these actually take effect, but this is just a good illustration of what we may see as this weight increase does take effect in future star ratings. Next slide. Okay, so I want to talk a little bit about what we see within our MTM programs, and most specifically with the CMR, or Comprehensive Medication Review Service. That really in our program is the one service where the patient really, it's very obvious to them that they're receiving a service. Some other targeted medication reviews or consultations are more, they're shorter, they're more targeted, and the patient may not even know that there was a service being provided to them as part of an MTM program. But the CMR is obviously does not fall into that category. They know they're sitting down with someone, they're reviewing all of their medications, they're asking questions. So we do have experience trying to measure that patient satisfaction and experience. So over the last 6 or so years, we've done member experience surveys in a variety of methods and for a variety of health plans across the nation. And generally, the results are pretty consistent. So around 82 to 85% would rate the CMR experience a 4 or 5 out of 5. So that is very positive and good results and very consistent. We have every survey that we've deployed, it's had a different set of questions. So a few other things I just want to point out is that we've seen 84% say they would recommend a review like this to their family or friends. 83% have said they felt more confident to manage their medications as a result of the CMR, and 76% said they would follow the pharmacist's suggestions. So generally very positive results from a member experience perspective with the CMR. So it's always good to look at that quantitative data, but it's also nice to see some qualitative feedback as well. So we pulled out some quotes from patients who have received a CMR. On the left-hand side, it's more, that's kind of the positives. And then on the right-hand side, if you're reading these, those are more, I'll call them constructive because they're not negative, but you know, not every patient thinks receiving a CMR was the best use of their time. So we pulled in some of those anecdotes as well. The first one, just to summarize this, basically this patient was saying they were appreciative of the pharmacist answering questions that this person always wanted to know, but never got from the doctors that they were interacting with. And really they dodged calls because you know plenty of outreach was being done to try to get the patient to do the CMR. But Susan, as the pharmacist here, helped the patient understand the importance of these calls and says, you have me for life now. So that is a trend we see, that sometimes it's hard to convince a patient to go through the CMR and take that time to sit down with the pharmacist or even do it over the phone. But usually once they do, they see how valuable it was, and they're very willing to do that again the next time they receive outreach to participate in that service. So the other one, bottom left here, I really liked and appreciated the time he took to make sure I understood the medication. He's the best pharmacist I ever had. I don't think there's, and then the next one, I don't think there's any more you can do. I was informed perfectly. And I had no idea that I was taking my thyroid medicine wrong. And then on the right side, those are the more constructive anecdotes, but it's not necessarily that they had a very negative experience. It was more just these individuals felt like they had a pretty good understanding of their medications to start, and either their healthcare providers, or they just felt well informed and could see why that was beneficial for some, but was not for that particular individual. And then this is my last slide, but I kind of mentioned this before. Once someone has participated in this experience, most often they find it valuable. And we've seen that they're twice as likely to accept the service the next year around. So a couple more anecdotes here, some quotes. This is the second year I've had a successful and reassuring pharmacy review. Thank you. I look forward to this review. It was very thorough. And I was surprised how helpful the time spent in the interview was. Thank you. So I think we as within the pharmacy profession, I think we all know how valuable pharmacists can be in providing services like this to individuals. Sometimes it's just a challenge to drive that patient demand for these services, but I think the more we get these services completed, the more likely they are to find it valuable for themselves, and likely share that with family and friends if they are having questions or concerns about their own medications. All right, I'll pass it over to Stacy to talk more from the Walgreens perspective.
Yeah, thank you, Danny. And likewise, I'm excited to be able to share the patient experience from our perspective in having nationwide pharmacies and the ability to impact patients in all communities across the nation. So what we look to continue to think through how we can be thoughtful around providing high quality care and support that is going to increase medication adherence and the patient's well-being and satisfaction in the care that they are receiving from our pharmacy teams. As one of the most accessible healthcare providers, pharmacists are in a key position to be able to provide personalized care through an omni-channel experience that does include some technology enhancements, but also being able to get that human touch and high quality care from the pharmacy team members. We offer a lot of different services that we're able to provide and strive to provide the right care solution at the right time to be able to improve the patient experience, always keeping the patient at the center of what these programs and offerings will support. We are also committed to the communities in which we serve that allows us to serve and support the needs of our patients, being able to additionally address health disparities and close some gaps in care. We strive to exceed our patients' experience by conveniently connecting them with the right solution at the right time and how they wish to receive it. With our brand footprint being nationwide, patients do have easy access and convenient options to be able to engage with and pick up their prescription, engage with that pharmacist, again, as one of the most accessible healthcare providers. We work to amplify our patient outcomes and medication adherence solutions and able to reach that patient where they are and when they need us the most. Again, keeping that patient at the center of all we do. We do have an omni-channel experience that is able to provide high-touch pharmacist outreach, as well as convenient digital tools that does help empower patients to keep them informed of their well-being and improve their medication adherence. Our pharmacist and pharmacy team members are the ones that are providing this patient care. And we partner with the patient's healthcare providers, making sure that the pharmacist is a true part of that healthcare team. We provide patient-level proportion of days covered, or PDC, visibility to our pharmacists that helps them in identifying the patients to better tailor their adherence conversations. We also utilize our internal clinical platform, identifying patients and bringing visibility to those patients that our pharmacists and pharmacy team members should be engaging in identifying where a potential adherence gap, an additional gap in care, or other patient outcomes needs may be available, all within daily workflow. So utilizing that clinical platform to allow our pharmacy team members to have that visibility, all while completing all of their duties within the pharmacy that day. We do utilize a predictive modeling customer care IQ that is an intelligent data engine that will empower our pharmacy teams to deliver those targeted personalized adherence interventions to the most at-risk patients, again, at the right time and in the right way, all while utilizing this data to bring those patients visible to the pharmacy team members. Several personalized interventions have been, I'm sorry, Amanda, if you can go back one. Thanks. We do have several personalized interventions that have been designed to help patients overcome their barriers to adherence, which does heavily rely on MTM support through our targeted and comprehensive medication reviews. We also utilize some other core adherence services, such as 90-day prescriptions, medication synchronization, and a prescription abandonment program, all by which help our patients achieve their optimal experience, whether in closing gaps in care or supporting that medication adherence. We also provide digital resources to, again, empower the patients to manage their care on their own and how they would like to through our app and .com experiences. We do offer several tools, again, as support to our patients, such as delivery, some refill reminders, automated refill, and ready status notifications. And with each of these services, support, and tools, we're offering continual support to that patient, but at the same time, we're reviewing continually the patient and team member feedback to optimize these offerings so that we know what the patient's needs are, as well as the needs of our pharmacy team members that are delivering these services. As I mentioned before, one of our core patient outcome services that our pharmacists deliver is through our medication therapy management, or MTM program. Our enhanced operational approach has empowered our pharmacists to be able to deliver effectively these MTM services through multiple work streams. We continue to look at evolving our processes, creating new efficiencies that will allow for higher completion rates, which in turn increases the patient's adherence, closes the gaps in care, improves patient outcomes, and does lower healthcare costs. Our enhanced MTM capabilities has allowed us to streamline the pharmacist's daily workflow through incorporating the MTM opportunities from our MTM partners at Outcomes MTM into our clinical platform. This in turn allows for the visibility of these MTM services to be visible to our team members as they're going through their daily workflow. This has significantly increased the efficiency in which our team members are able to engage the patients and complete these high quality MTM services. We're also able to create some technology enhancements, again, helping to drive efficiency in our team members being able to engage with the patients, offering these services and documenting within a timely manner. These efficiencies also have been created to support prescriber outreach and support prescriber interventions, in addition to the pharmacist recommendations or issues that may arise and be identified through MTM services to include that pharmacist as a core part of the patient's healthcare team. We are in support of and we do support a focused chain-wide MTM capabilities through both our in-store pharmacists as well as centralized services call center support, all of which who are able to support our MTM services and opportunities for our patients where allowed through our state regulations. Again, through continually listening to the pharmacy team members, our patient feedback, we are always able to take those next steps to evolve the patient experience, being able to support our patients when, how, and where they prefer. We do keep our patients at the forefront of all we do, which continually inspires us to keep the voice of the patient and relay that through each of our team members and their interactions. We know that these MTM interventions do lead to better medication adherence and improved health outcomes, such as improved A1C changes. And with that, I am excited to hand it over to our patient panelist, Richard Erickson, who will be sharing how pharmacist-led MTM services have impacted his health and quality of life. Richard?
Well, thank you for allowing me to address you folks today, and I want to thank the PQA organization for setting this up. I think in my experiences since getting diabetes, it's been a challenge getting the right information, the right medications, the right questions asked, and the right questions answered. And so in 2010, I was retired, and so I began volunteering at the healthcare clinic that I was attending for my care. And as part of those groups, I was able to initiate a diabetes support group. And we've had an average of 6 to 12 members over the 10 or 11 years that we've been functioning now. And of course, some members have passed on and some new members have joined. And clearly the challenge for the new members is the befuddlement of what do I do now, and how do I manage this? The keyword control my diabetes, control it with diet and exercises, and that isn't always the answer for our folks. We need some more in-depth communications, and of course, the MTM services have provided that for us. And my travels working with these folks, and then the people with the depression or addiction, the challenges of all the medication complexities are involved in our care. And so as we move through this change in our chronic diseases, I can't think of a more valuable resource than the MTM sources to help us through this challenge. In 2017, I was working with some people who volunteered me to join PQA as a volunteer there, and I've been on a couple of the working groups, and it's been very interesting and helpful. And I've been able to bring back some of that information to the diabetes support group so that they could also benefit from the work that you have done in the PQA organization. And I guess the benefit that I see is in working with MTM services, I can describe on my next chart, which describes my travels through the MTM organization and my travels through diabetes. In 2017, I started using the MTM services, and my A1C was going out of control. I had no idea what this diabetes was about, or the control, the capabilities of control through medication. Diet and exercise were always a challenge, as my natural capabilities of eating and misbehaving were active. So I needed some intervention, and this MTM service provided a pathway for me to gain information that I could not get anywhere else. And so as time progressed and I met with the MTM folks over time, my A1C began to decrease because of the medication changes. The actual reduction in side effects were reduced, and as you'll see later, that my whole profile of health improved. But more importantly, the changes in the pharmaceutical approach to my diabetes helped me reduce my A1C down. Now was measured this week at 6.9. So very effective progress in terms of getting my diabetes under control, because as you know, we fear the lasting side effects of this disease. So I could not have made this progress, I am assuring you, without the information and the advice and the help and the coordination between the MTM services and my clinic provider. That was a team effort in terms of the communication, so that I'll stress is a vital part of your program, is to make sure that you're in contact with the clinic that helps this person, and establish that closed loop communication so that they're able to, the clinic is also able to get the advice that you have given the patient, because today the complexity of medications are moving and migrating, I think, so much that the clinic is also in need of your services as well because of those changes that are going on. In addition to the benefits, you're right, the adherence to the program is much better. I've seen it with people who are coming to the group who are in denial about their diabetes, and they don't know how to manage it. And with this discussion, the CMRs and the MTM services, their adherence goes up, and their progress has been notable over time with the many members that have been joining. And I often share this story about one lady that came in, her A1C was well beyond the 9, and her denial, she admitted totally, and she had other medical conditions, of course, but with the MTM services available to her, and she was able to overcome, let's say, her denial and start working her program. Before she passed away from her heart conditions, she had her A1C reduced considerably, and she had felt so much better overall that that was just another a milestone event, I guess, in the travels that I've been on that show me that this communication with this service is vital to the people who are struggling with these chronic diseases. On my next chart, I'll show you the ancillary benefit. You know, when I started at 9-something A1C, I was on a medication that was increasing my appetite and increasing my weight. Well, I didn't need that help. So over time, as you can see now, with the medication changes, I've been able to also gain the benefit of the weight reduction. Now down to 170 pounds, and I feel so much better. And it again is directly related to the changes in medications and you know, just learning more about this disease from each of you, that I've been able to make these changes and benefited accordingly. My next slide, I guess, is to kind of address some of the questions that I've heard from the folks in the support group, because as I mentioned earlier, when they come in, we're often befuddled by what is it that I have? I didn't want to get it. I don't like it. I realize but hate the fact that it's permanent, and what is hard to sink in is that it's progressive as well. And as much as we try to do diet and exercise, often our bodies will change right under our noses, and so we're not stable. We have to continually be upgrading our program and without your help, of course, we don't know how to deal with these changes. And it is, you know, the first question is what is going on? Is it just the natural progression of this disease, or do I need my medications changed? I'm doing some diet and exercise. Do I need to do more? How much? How do I fit this challenge of the pharmaceutical world into my program of control? And then the side effects. Obviously, you know, every person that came into our group, some were on some of the same medications, but getting different results and different side effects. And so this question of side effects in relation to our new ailments is always a question for us, because we don't know if this drug is causing a side effect, or we're just our aging, or the combination of medications that we're on. So that there's always those questions coming up on the side effects, long-term, short-term. How are they affecting us? Will they affect us? And what can I do about it? And is there other medications that I can take that will do the same thing but not have the side effect? Those are all the questions that the MTM folks are vital in terms of getting us answers that make sense. Simple questions: over-the-counter medications. Do I take my medications in the morning and night? Do I mix them with other medications? Do they conflict with foods I'm eating, as I've heard? It's the whole gamut of understanding this whole pharmaceutical chemical world and the nature of us and how we react to those that you guys can help us with. And you do help us with, and that's significant in terms of our growth. And then the question comes up on continuous monitoring. Do I need to be on the continuous monitoring? My fluctuations over the past few days have been extreme. I've gone from 200 down to 90, and why is that? And some days it's stable. So the question is, do I need continuous monitoring to help with understanding what's going on? Again, more questions that we have and get as we travel through managing this disease. And without somebody to turn to, folks like you, we can become discouraged and frustrated with this disease, and then the adherence becomes a question. The taking the medications on the time becomes a question, challenge, and so other issues come up if we become discouraged or frustrated with our program. So we want to thank you for being part of our lives, because without you, again, we struggle with the understanding of what we're dealing with and how to go forward. And certainly a significant part of our positive health going forward is to work with the MTM services. So thank you. Questions, anybody?
All right, thank you so much, Richard. Thank you also to Danny and Stacy for being part of our panel today. Now we have time for a question and answer session. I want to remind everyone to put your questions for the panel into the questions box on the right side of your screen. We've got some coming in, but please keep them coming, and we will get to as many as we can through the rest of our session today. I'm going to pose the first question actually to everyone in the panel. So Richard, we'll start with you. Maybe we'll go in reverse order. Richard, then Stacy, then Danny. This is just a general question about COVID-19. So what barriers have you noticed, if any, related to COVID-19 that have affected the patient's perspective, Richard, on MTM, and then also maybe for Stacy and Danny, the ability to deliver effective MTM services? Richard, what do you think?
Our challenge at that with the COVID-19 is of course, the interaction between the vaccines and the medication we're taking, or the side effects of the medication of the vaccine itself. And then in the personal setting, our diabetes support group could not meet physically, so I had to set up an account where we could do like we're doing today, where we could keep in touch with our clinic and with our each other in our travels with this. So COVID did present a challenge for us to keep the group going and active and informed, but we've been able to overcome it with the current technology. But the fear has been with the interaction, of course, with the vaccine and our health and the medications.
All right, thank you, Richard. Stacy, any thoughts on that?
Yeah, we saw a definite shift, especially as shelter in place orders started coming through, a shift from face-to-face to more telephonic. But we also found that with the patients at home, you know, a lot of their normal daily distractions away, that they were available and excited to talk to the pharmacy team members about the MTM services. So it was an opportunity to be able to engage those patients where they might otherwise have felt like they were too busy to have these conversations. So we really did see an uptick in the acceptance rate of those. And then now, as we have moved past that part, we are starting to see or do see some of the capacity constraints that our pharmacy team members are experiencing as they are heavily participating in COVID vaccinations, but continue to work through those efficiencies that I mentioned earlier to be able to support our patients in receiving these services.
All right, thank you, Stacy. Danny, anything to add?
Yeah, I would echo a lot of what Stacy said. We've seen that type of activity reflected across our programs and across the different retail and community pharmacies. There was a definite uptick in service delivery last year about this time. And I think it, on top of what Stacy said, I think, you know, some people were feeling more isolated. Maybe we're really looking forward to having someone to talk to on the phone. We obviously saw a big shift in method of delivery of services from face-to-face to telephonic, which is not a surprise. But I think something else that maybe isn't as obvious is there was a lot of I don't know if you want to call it stockpiling, but maybe that is the right term, of medications. There were some, you could get higher day supply, things like that. And so I think we actually, another contributor to the increased activity from the community pharmacies was due to some staff being freed up, because maybe they were filling longer day supply and had some additional time to be delivering MTM services. That was another positive. This year we saw a definite decrease in activity kind of when we were in the midst of a lot of the vaccines being administered within pharmacies the last couple months, but we're definitely seeing a rebound in activity across the network as we head into the summer months.
All right, thank you, Danny. That's interesting about the increased capacity of community pharmacies potentially related to a, say, 3-month supply. Not something I'd thought about before, but definitely makes sense. Thanks to each of you for answering that question. The next question I have is for Stacy. Stacy, you mentioned prescription abandonment in your section. Can you speak to any efforts that you've made or that you know any others have made about why patients tend to abandon their prescriptions and what you can do to alleviate that issue?
Yeah, of course. So we do find a couple of the top reasons for prescription abandonment tend to be cost, transportation, and then simply forgetting to take their medication. So then they don't come to pick up the next prescription refill. And so what we have done is we have created a program to engage patients that have been identified as having a prescription that's ready, and it's been ready for a certain number of time, and so a certain number of days. And then our team members will engage with these patients to help identify what their barrier to picking up that prescription might be, help resolve those barriers, whether it be through the ability to deliver the prescription, and for the forgetfulness, being able to utilize some digital capabilities. So encouraging patients to sign up for refill reminders or ready status notification reminders, where they could get an email or a text message letting them know that their prescriptions are ready to be picked up. And so continuing to learn from those engagements with patients to be able to optimize that experience. And I continue to identify reasons for prescription abandonment and where we can support in resolving that.
Okay, very good. Thank you, Stacy. I'm getting some questions here that have a very similar theme. So I'm going to group these together and ask Richard for your thoughts first, and then Danny, and then Stacy. So it seems to be that sometimes there's some resistance. I'm seeing in some questions some skepticism among patients related to receiving MTM services. So Richard, in your experience with patient groups, what are the biggest fears or hesitancies that you hear about from other patients? And is there anything specific that you're able to say to them or anything that you can do to show the value of MTM or ease their fears?
Well, one of the things that I hear probably most often is this covered by my insurance, or is there a cost involved in this? And to allude, to get away from that, the services that I received were part of the coverage from the clinic that I was with. So it wasn't a question for the near-term people that I was working with, but for their friends, and the question always comes up, is it covered by my insurance? So that was probably a barrier in getting these folks to work. If it's not a cost coverage, then the question was, how does it relate to my clinic? How does the interface happen? What's the connectivity between the two, so that I can be assured that what I'm getting for advice here is compatible with what I'm getting at my clinic. So those are the two probably key areas that are of concern for people concerning MTM services and using it.
Okay, thank you, Richard. Danny, thoughts on that question?
Yeah, I think I touched on some of it with my content, but I feel like patients, and I'll speak to the CMR first, just because that's the most, I don't know, you've really got to try to convince patients to spend that time with you, versus other services that can be done a little bit quicker on the fly. But I think Richard makes a good point about making sure when you're offering the service, when it is covered by the plan, that they know there's not a cost, because that may be a concern. And with the CMR service in our program, that it's a covered benefit that they don't need to pay. That's probably not readily understood when you're kind of doing that CMR offer or inviting them to have that conversation. And then trying to articulate the value that they would get from it, I think is really important. Maybe using examples of things that you may be able to find, like, oh, that maybe the time of day you take your medications could be better. I'd like to run through that with you. Or I've been able to help patients find ways to save on their monthly co-pays, and I just want to help run through your list of medications to see if there are any opportunities like that. So those sorts of, you got to be ready with your talking points, because in some cases you probably don't have a whole lot of time to make that offer to a patient. But I think outside the CMR, the more targeted medication reviews, a lot of times the pharmacists are doing those things without as much acceptance. You don't need like an explicit acceptance from the patient in all cases. So I think those could be, and it depends on the service you're providing, those could be a little bit easier because they don't need as much commitment from the patient themselves to participate in it. And I think another thing is making sure they're aware, like if you're talking about changing a medication therapy, making patients know and aware that you plan to work with their prescriber or their physician to make those changes when that's required. I think that can be another barrier or a concern from patients that's probably good to try to address earlier, so they don't think you're trying to do something in a silo if they've got a good working relationship with their prescriber.
Sure, absolutely. Of course, those relationships are key for sure. Stacy, anything you'd like to add?
Actually, I think both Richard and Danny covered all of my talking points. Yeah, so if you have
Okay.
another question.
All right, sure. Danny, I've got one here for you. How do you and Outcomes make the patient experience with MTM consistent across so many different pharmacies?
Yeah, I think that's a great one. We are very thoughtful about the system requirements and the way we write overviews for like tips or other services that need to be provided. And that really is our effort to ensure consistency, not only among different pharmacies, but then if you think about it from a pharmacy's perspective that's providing services for various health plans or lots of patients across health plans, that there is a lot of value in standardizing that experience from both perspectives. And so we're very thoughtful about how we do that while also providing sufficient flexibility to meet the goals of the specific intervention or service that we're trying to encourage be done by the pharmacist with patients. So so very prescriptive on like these things need to be documented in the system, lots of resources. We do quality assurance of the claims to make sure the services are provided in compliance with our policy and procedure guide. So we have a lot of strategies to ensure that level of consistency.
All right, very good. Thank you, Danny. I've got another question that I'd be interested in everyone's perspective on. We'll start with Stacy on this one and then go to Danny and Richard. So when pharmacists perform MTM services, do you feel like there is a role to help the health team to either screen or monitor for patients and any social determinants of health issues that they may be experiencing? So lack of access to food, housing, transportation, these sorts of things. And if you see that as part of the MTM service, what might that look like? Stacy, what are your thoughts on that one?
So I think it's an interesting question, kind of a hot topic for us right now. I definitely think there is a role for the pharmacy to be involved here, but I also think it's important for the pharmacy teams to have access to the resources to be able to support the patients. So not only being able to identify and provide back that data to a health plan on the social determinants of health of their patients, I do feel very strongly about being able to provide resources or being able to provide the option to support the patients in the social determinants of health that they've experienced. For example, if they have a transportation barrier, can we support through delivery of medications? But that's not going to solve all of their transportation issues. And how do we help connect the dots for the patients there?
Thank you, Stacy. Danny, thoughts on that one?
Yeah, I think Stacy hit some good points there. Maybe a few things I would add is I feel like pharmacy staff and pharmacists have been very, very aware of these types of challenges patients are experiencing, at least from a perception perspective. Like, if you've ever worked in a pharmacy, you know which patients may not be able to pay for their medications. That can become very obvious. You can tell, you know, if you've got a pharmacy in a grocery store, you're seeing some of that aspect of what kind of food they're buying, or maybe you have those types of conversations. I've witnessed patients be pretty open with pharmacists about those types of things, but I think there's and I use the word perceived because I think pharmacy staff probably can perceive those barriers, but it's a matter of if you need for uses by health plans or other entities, are you comfortable relying on perceptions, or do you need them to actually tell you for themselves, like complete an actual assessment, like you see done in doctors' offices? We've done some pilots where we actually do deploy an assessment where the pharmacists are actually asking those pointed questions around, have you ever run out of food? Do you feel safe in your home? Those types of things. But the key is really trying to make sure there are solutions the pharmacist can offer, because just uncovering those challenges a patient is experiencing and then leaving it at that doesn't make anyone feel very good. So I think it's very, very important to try to leverage resources as much as possible.
Good point. Thank you so much. Richard, what are your thoughts on this topic?
Well, it's certainly a concern because most of the people that attend our group are really not financially well off. And so one of the blessings of the clinic that I'm involved in is we've also, as a patient partner, been able to start and join the health care clinic's efforts in providing a food shelf. And so the questions are often asked of the patients attending, have you had shortages in foods? And we've been able to either send them home with packages, or we built a food shelf kind of thing in the entryway and the travels, so people could drop off foods as well as take foods. And so there was a sign there that, you know, help yourself to those things that you need, and then leave if you want to leave a donation or leave food. There's places for that to happen. So the discussion comes up often because of the nature of the environment we're in, that there are, you know, some that are struggling quite a bit. And the question in the pharmaceutical world and the insurance world is that donut hole thing that affects people also. They often have to make that choice between food or medicine. And so those discussions come up as well.
Yes, absolutely. And that's a very difficult decision and something that no one should have to decide between those two, for sure.
Mm-hmm.
So we had a general question here about how feedback is solicited from patients when they receive a CMR. So let's start with Danny and then go to Stacy, and then I'd like to hear Richard's perspective too. Is it an automatic survey? Is there a feedback that the pharmacist solicits at the end of the CMR? How does that process work?
Yeah, so our experience has been, we don't survey every patient after every CMR. we kind of leave it up to our client, our health plan, or PBM customer, and how they want to implement something like this. But we have deployed surveys over a variety of methods. So we've done IVR phone calls, email, and text messages. And the results of that are fairly consistent. So I think it typically, those go out automatically within, we usually try to tie it pretty soon after the CMR is actually completed, so they know what interaction with the pharmacist they were referring to. So within 14 days is probably ideal. But we've used a variety of methods.
All right, thanks, Danny. Stacy?
For us, the most common feedback we receive is directly with the pharmacist post the completion of the service, whether it be through the telephonic service or face-to-face.
Okay, very good. And then Richard, how has your feedback been solicited, and do you like how that's done, or do you think there's room for improvement?
Well, the process that happens, automatically with the diabetes support group people is we encourage them to do the CMRs and the MTM services. And then when they come back into the group, they often say, without even too much of a question, is how well it went and what did they get out of it, and would they do it again? And so the comments match what Danny had on her slides earlier, is that the significant portion all benefited and enjoyed and wanted to do it again, the CMR and MTM services thing. So I get it by hearing from them as they come back into the group after a meeting.
Okay, very good. Thank you. Richard, we will end with one last question for you. So what advice do you have for payers and pharmacies to help better care for patients? So let's just leave that wide open. We'd love to end with your comments.
Okay, well, increased dialogue, increased openness between the pharmacist and the patient, the client and the patient and the clinic. All of that improved communication is probably the cornerstone of the progress that can be made in our care. And so I would encourage that as probably the most point that I would emphasize, is to be open. Understand that we do have questions and we're sometimes very awkward or bashful about asking them. And so be open to initiating conversations and engaging with us, because we really do have questions and we really have challenges, and we do appreciate your services. So that's my 2 cents on that item.
All right. Thank you, Richard. We appreciate your perspective, and Danny and Stacy, your perspectives as well. So thank you to all of you for joining us today. That's all the time we do have for questions. Thank you so much to the participants for the robust discussion with our chat questions. To let you know, our next Quality Forum webinar is going to be held on Thursday, July 22nd. On that day, we will hear from Dr. Cheryl Pinto, the department head and Hoke Endowed Professor for Community Pharmacy Practice at South Dakota State University. Dr. Pinto is the recipient of this year's Community Pharmacy Innovation and Quality Award in the individual category, which was announced last month by PQA and the Community Pharmacy Foundation. Dr. Pinto is going to share some work that she has done over the past several years within innovative pharmacy practice models. And then finally, I would like to remind all attendees to please answer the brief survey that appears at the end of the webinar. And then the recording and the slides will be distributed within the next week and also made available on our website. Thank you to everyone for attending, and have a great day.